Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're discussing the challenging topic of suicide prevention and the resources available for those at risk or affected by suicide. Next, we'll get the details on an exciting study regarding older adults and exercise and how you can get involved in the research. Finally, we're talking with assisted living locators about their services helping older adults find the perfect new home as their needs change. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. Today we're talking about National Suicide Prevention Awareness Month, which is recognized every September. We've got Eric Rutledge from Baptist Behavioral Health Services to tell us more about this difficult topic. Thank you, Eric, for being here with us today.
Well, thank y'all for having me. I appreciate the opportunity to talk about a subject that I'm very passionate about.
So what does the data show us about suicide?
So unfortunately, the data that we have most recently from 2023 has shown an increase in the rate of suicide deaths and attempts. In 2023, there were 1.5 million suicide attempts, and 49,000 of those were successful in the United States, which marked an increase of about 14.2 deaths per 100,000 people.
Who is at risk of suicide?
So everyone's at risk. It can impact every age group, from those we now measure as young as 4 years old all the way into geriatric, older populations. In fact, that's one of the highest risk demographics is that age group. But yeah, anybody can be impacted by it. It is the 11th highest cause of death in the country overall. And that becomes higher. It's the second leading cause of death for pediatrics, so anyone under the age of 17. So it can be anything across the board. Of course, there are some that have a higher risk, but it impacts us all, every single member of society that risk for this.
Are there groups or demographics that are more at risk than others?
So it's kind of shocking. It's a little opposite of what people would think it would be. So those living in a rural community have a higher risk. And a lot of that is just because of access to mental health care. Those who have a history of substance use disorder, that's alcohol, prescription medications, or illegal drugs, they also have a higher disposition towards suicidal behavior and attempt, as well as those with a previous mental health diagnosis. That could be anything from major depression to schizophrenia, bipolar disorder. We've just noticed that they have a higher tendency. Also, those with serious medical conditions, especially those that have pain associated with those conditions. So chronic pain is a huge contributor, especially in some age groups.
What are the signs that someone may be at risk of suicide?
So there's a lot of them, and it just kind of depends on your familiarity. You couldn't walk up to someone, just randomly and maybe know. But if they're talking, you're having a conversation with a friend and they made a comment about killing themselves, even jokingly, or feeling hopeless, or again, back to if they're in pain and they just discussed their physical condition, or maybe they're just in a lot of emotional pain or grief. Those are all indicators. Increased substance use. So if you see someone drinking a lot more and they're also kind of depressed or they're withdrawing from activities, and we get busy at different times of year and we can't always do everything we normally would do. But if you see a significant withdrawal from something that that they used to love, or if they're isolating and not participating in things they normally do, and there's no other reason behind it. Sometimes we have a medical condition that mobility is a thing. But also, if there's some fatigue or if you've noticed aggression in your friend, that can be a sign that they are struggling, and it might be time to have a conversation with them.
What are some things we can do if we think that someone may be considering suicide or having suicidal ideation?
So, not always the easiest thing to do, even for those of us who are trained to do so. But listen to them and have a frank and open conversation about your concern. It may be that you have a conversation and you think, oh, I was wrong. But tell them, hey, have you thought about this? Because you're showing some of the signs and I was worried about you. Is there anything I can do? And you'd be surprised at the number of people who open up at that point, and they're just waiting for that person to have that conversation with them. And it's scary if you're not familiar with what to do, but also just provide that support and encourage them to seek care. Of course, if it's a crisis situation, you'd want to help right then. If they said, oh, yeah, I'm having those thoughts and I've even thought about how I would do it. Yeah, that's a crisis, and there's some immediate interventions that you can take. So.
What resources are available in the community for someone who is thinking about suicide?
So we're improving dramatically. 988 is probably one of our biggest assets that we have right now. Similar to 911, it's just all about mental health. It's a suicide prevention crisis line. They have specialized counselors. We actually in the Panhandle are very lucky. United Way has helped us out. They man that, and we have one of the fastest answer and response times in the country here. So excellent work there. There's always someone on the other end. There's also mobile response teams. Of course, there's receiving facilities. You can come to an ER and talk to us. Here at Baptist, we have people stationed 24/7, counselors in our ER for things such as this. Other organizations in the community that we're blessed to have local representation, the American Foundation for Suicide Prevention. In fact, we have several events in the month of September because it's National Suicide Awareness Month. So we have events scheduled with them. NAMI, the National Alliance of Mental Illness, I'm sorry, the National NAMI, we'll just say NAMI of the Emerald Coast, has a strong representation here. They're advocates for peer support and have support groups for free all over. So lots of resources.
Who can we reach out to if we have more questions about this topic?
So there's a lot of stuff online. You can call 988 and they actually can direct you where you need to go. Also 211. The American Foundation for Suicide Prevention has an excellent website. And it's not just events and things that are coming up, but what you can do to get involved, trainings that are available if you're having thoughts yourself, if you're seeking help. And then also NAMI, they have excellent website, events coming up, things in the community to help get involved. So lots of things like that, resources available online. We continuously reach out as a community. We formed a mental health task force that is working diligently to improve access to services in our community and streamline our development team. So,
thank you, Eric.
thank y'all for having me.
Stay with us. We'll be digging into some cutting-edge research on aging and exercise happening at IHMC up next.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
The Institute for Human and Machine Cognition is a not-for-profit research institute doing cutting-edge science right here in Pensacola. One of IHMC's current research initiatives is recruiting people 60 years and older for a 7-month trial to better understand the health benefits of exercise. Here to tell us about this project and who is eligible to participate is Senior Research Scientist Dr. Marcas Bamman. So thank you for joining me today.
Thank you for having me. Happy to be here.
Well, first of all, tell us a little bit about IHMC, what the overall mission and purpose of it is.
Sure. So the Institute was founded 35 years ago. So in 1990 it started. Dr. Ken Ford founded it. The focus is really on advancing the human condition. We do that in 3 areas. The first area and the founding pillar at IHMC is focused on computer science, amplified intelligence, and machine learning. 10 years later, added a robotics initiative, and then more recently, a more biomedically research-focused initiative we call Health Span Resilience and Performance, and that's only been about the last 5 or 6 years.
Awesome. Well, tell us about this study. What is it called, and what is it asking?
Sure. So the NIH, and specifically within the NIH, the National Institute on Aging, was really asking a question that's really important for society, and that question is, why is it when people try to reap the health benefits of exercise training, some individuals reap those benefits more easily than others? So the question is focused on the variation in response and how can we mitigate that variation. In other words, what can we do to boost the responsiveness of all older adults so they all reap those really critically important health benefits. So the study is combining endurance and resistance training. We follow the public health guidelines on that. Despite our individuals' gravity toward one or the other, we should all do both to reap the full benefits of exercise training. So this is a combined training study. It's a 2-phase trial. We call it the MAX trial to maximize the health benefits, once again, of exercise training. For the first 12 weeks, individuals come to us in a supervised setting 3 days a week, undergo rigorous exercise training. We collect a lot of data along the way. We're assessing everything from muscle function to cardiorespiratory function to cognitive performance, and the list goes on. At the end of 12 weeks, which is sort of phase 1, we define each person based upon how well they responded in 2 clinically important outcomes. And then we have a follow-on phase 2, which is a boosting phase. So for those who didn't achieve the outcomes that we were hoping, phase 2 is all about modifying the program for those people, for those individuals, to maximize their benefits. So each person might be involved with us for about 27 or 28 weeks in total. Exercise training itself is 22 weeks of that time. We're learning a lot. We're collecting a lot of data, collecting a lot of biospecimens along the way to help us understand the mechanisms of exercise adaptation as well. And this community has really just gotten excited about this trial. We've had really great turnout from the older adult community here in Pensacola and beyond Pensacola. So I will say it's a 3-site effort. So IHMC is the hub. We have 1 spoke in Oklahoma City at the Oklahoma Medical Research Foundation. They have a really outstanding aging research team there. They're conducting the study as well. And then University of Florida is involved as well.
Gotcha. And so we know that people need to be 60 and older, but what are some of the other criteria that people need to be eligible as a research subject for this?
So for an exercise trial, in this case, studying people who are not already trained, have not already achieved many of the health benefits of exercise training, we're starting with people who are not performing weekly exercise on a regular basis, at least not at the intensity and rigor that we want. So we call them untrained, right? So we're recruiting people who don't have a current exercise habit that would exclude them. We're also excluding people on a few medications that would be contraindicated and actually influence the results a little bit. So these are generally healthy older adults. All of us at every age carry some burden from a health standpoint. Not everything is excluded, but we do have just a short list of exclusionary criteria.
And you talked a bit about what participation will look like. Tell me a little bit more about that, about the facilities where people will be doing this, because I know you're already undergoing this research now, right?
Yeah, so it's really exciting. IHMC opened a new biomedical research complex. We call it the Health Span Resilience and Performance Research Complex. We opened that in May of 2024, so it's just a little bit over a year old.
Yeah.
It's a fabulous building. It's 40,000 square feet. It's just on South Alcanese, near the corner of Alcanese and Romana. We have a 5,000 square foot exercise facility within it. We have all the testing laboratories that we need to do all the clinical testing as well as the more mechanistic work. We have a lot of what we call wet laboratories to analyze blood samples and things like that. So that's where it's located. So you get, those who participate get a certified, credentialed, and really well trained personal trainer. And then they interact with a lot of scientists from various disciplines along the way.
Excellent. Yeah, so they get some really, really high-tech, cutting-edge personal training, and then some tests as well with that. So when can you say when the results of this might be available for the public to see?
Well, it's a 5-year trial. Within the 5 years, we're just completing year 1 now. So the results will be, 3 years away or so, because our intent is to complete the study of the human participants in 3.5 years total, giving us 1.5 years to analyze all the data, publish manuscripts and things of that sort. So contribute to the scientific literature and move the field forward, we need some time to do that. So I would say 3.5 years in total, which we're already 1 year into that.
Okay, so we need to be patient here.
Be patient.
Let you guys cook.
We will float out, bits of information as we go along. Each individual participant, though, gets immediate results. So, and they've really enjoyed that. I think at the end of the first 12 weeks, we give them a consultation, we tell them how they did, we show them some of their results, and then we sort of define for them what's next. And the enthusiasm has been fantastic. Regardless of whether or not somebody is classified as somebody who needs boosting, they've all been enthusiastic and continue.
Excellent. So quickly, can you share any other aging-related research you have on the horizon?
Yeah, we actually have another NIH-funded study that's just starting, where we're studying sort of the differences between young and older adults in what we call walking economy. And the simplest way to say that is, as we get older, the metabolic cost, the energy we use to just move in our environment goes up. And we want to understand why that is and see if there are ways that we can improve walking ability and just general mobility in older adults. So that one will recruit a different cohort of people. They'll also be over the age of 60.
All right, well, we'll keep our eye out for that.
Okay.
Thank you for joining us.
Thank you for having me.
Up next, what to do when facing the transition to assisted living. Stay tuned.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
So much.
Fostering a pet for a friend or neighbor can keep families together. Learn more at petsandpeopletogether.org.
For those who have lived independently for their adult lives, the prospect of transitioning into a more communal environment like an assisted living facility can be daunting. The varying options, amenities, and price points can be overwhelming. Joining us today is Samantha Williams with Assisted Living Locators to discuss this transition. Thank you for being here today, Samantha.
Thank you for having me.
So first off, what is Assisted Living Locators?
Assisted Living Locators is a placement agency helping seniors transition for their next time in their life, right? Their next journey. So whether if it's independent, assisted living, and or memory care, we deep dive into their budget and help them within their needs of what community works for them.
Awesome. Well,
Yeah.
What are some of the things for people to consider when they're making that decision?
I always find it very important to let's look, is it something that you're having trouble with? Food, cooking, is that a necessity? Of course it's a necessity, but it's a hard time sometimes when you're in your 80s, 70s or 80s having that time to go out and cook and driving to go get the groceries. Let's look at that as a assisted livings and independent livings. Even memory care can assist with that, food, and also any other needs. Did I even answer that question?
Yes, definitely.
Okay.
So you look at the challenges that the person is facing that are specific to them and maybe what community is going to meet those needs the best.
Right, yes. So we deep dive into that, so yeah.
So how do you know when it's time to start thinking about moving to an assisted living or some other type of facility when you're living independently? I know a lot of people, they want to stay in their home, and we want them to stay in their home for as long as that's safe and possible. But when is it time to start thinking about making a transition?
Well, that's when things start coming into play, right? They reach out when it's crisis mode, where they have fallen or they're slipping a lot, they can't drive anymore, or they end up in the hospital, and then that's that time of transition. Let's get ahead of that. Let's start just going to assisted living so we can go and do some tours and take a look at what they actually look like. They're cute apartments that have so many needs. Even if you don't need a nurse, at least there's somebody there that can assist you whenever that time comes. So let's just deep dive into the next steps of success and not leaning more towards the crisis mode.
Right, so start thinking about it before you maybe think that you need to.
Right, yeah. Even if you want to be on the waiting list, you don't have to come right away, but they can call you and say, hey, are you ready now? No, not yet? Okay, well, we'll wait another couple months or a year, but at least you're on the waiting list.
Yeah, that's an excellent point, because if there's a waiting list, then when you need it, you're still going to have to wait.
Right, exactly.
So what are the different types of facilities that are here in our community, and how do people know what's right for them?
Okay, so we have independent livings, we have assisted livings, and then we also have memory care, dementia, anybody that's wandering, Alzheimer's, so we have those as well. There's also long-term care Medicaid communities that can assist as well. So there's a handful of those from Pensacola all the way to Destin. So I can assist with all of those. And yeah, so we have those.
And are there facility options for lower income individuals? I think you just mentioned that.
Yeah, there are, and then we can go and tour those. But the good thing about the long-term, we have to take in consideration the long-term care Medicaid communities. They do not allow animals in those, so a lot of them want to keep their pets with them, but with that, they cannot do with long-term care Medicaid.
Gotcha, and that brings me to my next question. What are some of those different kind of restrictions that people might see? Some don't allow pets, things like that.
Yeah, some don't allow pets. Other ones do allow pets. The long-term care Medicaids don't allow pets, but other communities do. There's a weight limit on the animals as well. I believe it's around 20 pounds or something. You can have cats and dogs. But there's also, you can come and go in the building. You're not restricted as long as it's not memory care, right? But other than that, you can come and go at any time as long as you just pay for your monthly rent. It's just like owning your house. You always have to pay your mortgage, right?
Right.
So anytime you can come and go and see your family that's up in Canada or Colorado or whatever. But as long as you're just paying for that and your monthly rent.
And what are some of the benefits that people see if people want to stay in their home but they end up moving to a community, and what's something that people find that they enjoy about moving to a more communal situation?
I would say the number one thing is they're having a hard time being at home because they're depressed, and actually socializing, meeting friends, getting involved, going out into the community. I mean, they even go to the casino once a quarter, right? And they also have primary physicians that come into their apartments as well, and that's nice. Yeah, you can have, it's just like being at home. It's your home. There's just people there to assist you, and that's the beauty of it. You don't need them, but when you do, you can just push that pendant or open the door and look down the hall. The cleaning lady's there. There's always someone around, because if you're at home, you fall, it's going to be a very hard time to get that help when needed, right?
Right. And I know people value their independence, but you still do have some independence, but you also have community so much closer.
100%, yes. You can even have your car. If you like to drive, you can have your car there too. So yeah, there's just so many good qualities about assisted living communities, or even independent, right? You can go independently, but you also have 3 meals a day. So that's always something, it's great. It's really, truly great.
Yeah. And what would you say to someone who's beginning that journey, thinking about maybe making the transition?
Well, what I would do first, I would want to come out there and meet them, sit in their home, and it's a hand-holding process. It's not just being all by yourself and you have nobody around. We can do this together. It's a white glove service. I have teams that could help you move. And we look down at your budget, and then we go on some tours that can assist you within your budget. And then they have an idea what assisted living is. It's not a hospital setting. It's an apartment. It's cozy, it's quaint, and it's nice.
Yeah.
Yeah.
Anything else you want to let people know about assisted living locators?
Assisted living locators, we are here. We actually have, our building is off of Cervantes, and we are also from Mobile all the way to Destin. So if you have any questions, please reach out. We are here. Assisted living locators is here to help you.
Excellent. Well,
Yeah.
Thank you so much for being here.
Thanks for having me.
And thank you for watching. Until next time, enjoy life. You've earned it.